You are dispatched to a 25-year-old woman that was shot in the thigh while hunting with friends.
TB on, is my scene safe?
Your scene is safe.
The mechanism of injury here is that she was shot in the thigh while hunting with friends. Is this my only patient? I only see one patient.
This is your only patient.
I'm going to request additional ALS support, and I'm going to have my partner hold manual C-spine stabilization.
I'm going to hold your head. Try not to move, okay?
My general impression of the patient is poor. Hi, my name is Evelyn. I'm the EMT. What's your name?
Hi, I'm Jean.
Do you know where you are?
I don't know.
Do you know what time it is?
No.
And why did you call 911 today?
I got shot on my thigh.
Okay, my patient's alert. She's CAO ×2. Do you mind if I just lay you down supine? Is that okay?
Yeah.
Okay. So the chief complaint here is that she was shot in the left thigh. Are there any immediate life threats?
Yes, the injury to her thigh.
I'm going to apply pressure. So I'm going to do a jaw thrust to check her airway. Do I see anything in there?
Airway is clear.
Okay, her breathing looks adequate, and so does her ventilation. What's my patient's breathing?
26 breaths per minute. It's rapid.
Okay, and I'm going to check for circulation now. I'm going to check your pulse. Is that okay?
Mm-hmm.
The pulse is strong and regular.
Pulse is rapid and weak.
Okay, and I'm going to check for skin color and condition. Her skin is warm, pink, and dry.
Skin is pale, cool, and clammy.
And do I have any other major bleeding besides this?
No.
Okay, I am going to administer 15 liters via the non-rebreather and lay her supine. I'm also going to control the bleeding. Okay, I'm applying direct pressure to the wound. Does the bleeding stop?
No, the bleeding does not stop.
Okay, let's secure the bandage in place. Apply the tourniquet 2 inches above the wound.
Bleeding is controlled.
All right, I'm gonna write the time on the tourniquet. I'm gonna administer oxygen. And I'm going to put a blanket on her to conserve heat. And I'm going to transport immediately because she is high priority. All right, I'm going to take vitals now while my partner gets sample history.
So what are your symptoms today, ma'am? How do you feel?
I just got shot on my thigh. That's it.
Mm-hmm. Do you have any allergies I should be aware of? No?
No.
And are you taking any medications currently?
No.
Okay. Has anything like this ever happened in the past?
No.
Okay. When was the last time you ate?
3 hours ago.
Okay. And what were you doing before this happened?
Was like hunting.
Mm-hmm.
So I just got shot on my thigh.
Mm-hmm.
Yeah.
Okay. Is there a lot of pain right now?
Yeah.
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 And is anything gonna making it better or worse?
Having stable.
Okay. So can you describe the pain? Is it like a shooting pain or?
Shooting pain.
Okay. On a scale of 1 to 10, how would you rate your pain today?
10.
Does the pain go anywhere, or is it only staying in your thigh?
Same time.
Okay. And when did this happen? Like 30 minutes?
30 minutes ago.
Okay.
Okay, patient is trauma naked. We're gonna start the physical assessment. I'm gonna check the head for any crepitus or decap BTLS. I'm checking the ears, nose, and mouth for any cerebral spinal fluid or blood. Checking the face for stability and decap BTLS. I do not see battle wounds or raccoon eyes. Checking the neck for tracheal deviation and jugular vein distension. I'm checking the neck for any spinal step off, going down to the shoulders, checking the clavicles for decap BTLS. And I'm going to apply the C-collar. And this was after measuring C-collar. Okay. Okay, so I'm going to check the chest for sternum stability.
Everything is stable.
I'm going to check for breathing. All right, can you breathe in? All right, one more time. Okay, can you check? I'm going to check for breathing again. Okay, one more time. Okay, I see equal chest rise and fall. Lung sounds are clear and equally bilateral.
As you find it.
I don't feel any broken ribs or decap BTLS. Now moving on to the four quadrants of the abdomen. I don't feel anything rigid or tender.
As you find it.
I'm gonna check for pelvic stability.
Pelvis is stable.
Sweeping for priapism, and I do not see any incontinence.
As you find.
Okay, I'm checking down the leg for decap BTLS. I see a penetrating wound in the left thigh. Checking this leg for decap BTLS. Now I'm going to check for circulatory, motor, and function. Checking the pulses. They're strong, present, equally bilateral. Can you wiggle your toes? Which foot am I touching?
Left,
How about now?
right.
Okay. Moving up to the upper extremities. Gonna check down the arm for decap BTLS and down the other arm. Gonna check for pulses. They're present and equally bilateral. Can you wiggle your fingers? Can you wiggle your fingers? Okay. Which hand am I touching?
Right.
How about now?
Left.
Okay.
Okay.
Okay, now we're gonna turn you around. I'm gonna put this hand up here and this one right here. One hand on the hip and on the shoulder, and on the head count, we're gonna roll her over.
1, 2, 3.
Okay. Going down the spine to check for any step-offs and decap BTLS, down the buttocks for decap BTLS.
Everything is
And-
good.
And on your count, we're gonna go back down.
Okay, 1, 2, 3.
The physical assessment's complete. Are there any secondary injuries or wounds?
None are present.
Okay, I'm gonna reassess her every 5 minutes.